This is near and dear to my heart, and it should be, I believe, to all mental health professionals who will interpret test or assessment instruments with clients. And I emphasize with clients instead of to clients. They need to be active participants in this if at all possible. Now, I realize with a child and parents and intelligence tests, there can be things that are not shared or too complex for the child. But if we're looking at adolescent and adult and we're interpreting assessment instruments, let's do it with them. It's collaborative. With any type of an assessment instrument, we want to make sure that we know the reliability, the validity, and the norming group. And I can assure you, no matter how good of a job the test developers did at making this norm group as diverse as possible, is still not going to fit your client. Clients are unique, and something I'm going to just be aware of, that they're unique and their issues are complex, and we always need to take that into mind when we're interpreting. Keep in mind and make the clients aware that tests are only a piece of their puzzle. No test or no group of tests can define anybody. They can be very helpful in increasing insight or increasing discussion about self, such as a personality test or a career inventory or a mental health type test to help people understand different issues that they may be experiencing, and perhaps there's a name for those issues. That can be very helpful at times, but no test can define. It's only a piece of the puzzle. As I mentioned, people and their issues are complex. I think we way too often try to simplify issues. And, it could be said that psychology was trying to kind of base their model off the medical model, and the medical model was trying to do it off kind of the hard sciences, chemistry and engineering and so forth. And it just doesn't work that way. People are complex. And there is a saying that the longer you're in the counseling profession, the more of a humanist you become. So there's far less direction that you're giving, and there's a lot more listening and reflecting and summarizing and brainstorming with and so forth. So that's how the test interpretation should happen as well. Experienced counselors know this. So let's go ahead and get that in our mind, that we need to be very open to what clients interpret these results to mean. No results are predictions of somebody's behavior. A lot of these tests, and some of the personality tests or considered personality tests, are really looking for maladaptive behaviors and problems and so forth. They're not looking for strengths. I think we're seeing more strengths tests come about, which is nice, but make them aware that this is not about predicting anything. Encourage clients throughout the process to ask questions. And we should stop and say, tell me what this means to you so far. Okay? Because does this make sense could potentially get a closed answer, is a closed question, and could get yes, no, what have you. So, hey, let's stop for a second, because I know this is a lot of information. Tell me what this means to you now. Okay? Ultimately, the client validates the results of the test. Okay. Now, hopefully we've used a reliable and a valid instrument with a very diverse norm group, but at the end of the day, the client validates whether these results mean anything and are useful. Okay? We always keep that in mind. That empowers clients to let them know that they validate the results. We also want to discuss these results in light of other information we've had from clients. Hopefully we didn't just give tests, that we've talked to them and we've gathered information, and maybe we've done a lifeline thing that I've posted up there. Maybe we've done an eco map and so forth, so that we've got a lot of information and we can discuss results and integrate the results in the other information that we have. Tell the clients what the results don't mean. For instance, a career inventory typically will just tell them maybe what their interests are. It doesn't tell them what their motivation or their grit is in actually moving towards being whatever career it's suggested. Like I said before, a lot of times the personality tests are looking for problems. It's not totally looking for strengths. Intelligence tests, the kind of the typical ones you think about, are really kind of limited to speed and short-term memory and maybe abstract thinking, and there's a lot more to intelligence than that. There's creativity, there's musical ability, athletic ability, emotional intelligence. Intelligence is so broad. There'll never be 10 different types of tests that could actually measure intelligence. And also we know that one's motivation and determination are a far better predictor of their school and life success than an IQ score. So also collaboratively interpret with clients. So tell them like, hey, I'm going to kind of read these results with you, and you let me know what's working or what you understand and won't and what doesn't. But make them aware that they are a part of this process. And also at the end, have clients discuss what this means to them and how they can use it. When we talk about treatment validity, one of the criterion related validities, treatment validity is probably the most important, because it's like, hey, did this test help you? Did it generate hope? Did it increase your understanding of yourself and the issues you're experiencing, or the direction you want to go in terms of career or school or relationships? So that's the treatment validity, and at the end, let's make sure we discuss that and allow plenty of time. So this is critical in any type of assessment, is to understand to do ethical test interpretation and make sure that no test is going to fit a client perfectly. So we've got to interpret with them and that they ultimately validate.